Hi, everyone. This is Cecilia with Jola Holmes at Keller Williams. Welcome, everyone, to our seminar. It's my pleasure to invite my friend Ray from our expert in medical insurance to talk to us about health insurance, the basic of Medicare, as well as open enrollment. We all know it's enrollment season, so I really appreciate Ray to take the time to share with us her knowledge and help us to look at different options for you and possibly for your family and people you work with. Welcome, Ray.
Yeah, thank you.
Okay, so I'm going to have a quick introduction about our company. Our company was set up in 2013. Our purpose is to help people, have a extraordinary experience when they're moving from one place to the other. Over the last 7 years, we helped over 100 families relocated to the area, and we're proud to also participate actively in the Asian Real Estate Association of America. We are pretty widely, education is a great part of our service. We believe if you have the right information, you can, make the best choice when you're looking to sell or buy or invest in real estate. And we have hosted over 300 seminars over the last 6 years, including seminars like we co-host with great partners like Ray to educate our buyers about everything about living in Dallas-Fort Worth area. Okay, so I am going to turn the stage to Ray, and she's going to give us a very informative seminar on Medicare open enrollment, and we're going to leave the floor for questions towards the last 10 minutes. If you have questions, feel free to, you can also type in the chat box, and so we can, answer the question towards the end of the meeting. Let me give the stage to Ray. Welcome.
Okay. So first of all, let me start sharing my screen with you guys about our presentation. My name is Ray Zhang. I own an insurance agency in North Texas, and we do a source of personal insurance. Today's topic is on health insurance, and we're gonna talk about some Medicare knowledge, some Medicare basics, coverage options, enrollment periods, Medicare late enrollment penalties. A lot of people are not familiar with those, and marketplace health plans because we're in the enrollment season. We also talk about some basics for comparing health plans and marketplace health plan subsidies. So first on Medicare. Medicare was created by Congress in 1965. It primarily provides health insurance for people over 65. Now, although for people who are younger than 65 can also be eligible for Medicare if they have been receiving disability checks for 24 months, at least 24 months. And people who have end-stage renal disease or ALS. The eligibility is that they must be US citizen or permanent residents for at least 5 years without a break in residency. Medicare is administered by Centers for Medicare and Medicaid Services. There are 4 parts of Medicare. The original Medicare consists of 2 parts, Part A and Part B. Part A primarily is for the confinement, where we spend 24 hours at least in a hospital, inpatient stay. Also include skilled nursing, home health care, and hospice. Part B primarily refers to outpatient services, doctors, diagnostic tests, durable medical equipment, etc. Part C is the Medicare Advantage plans, which we'll discuss a little bit later. And Part D is the prescription drug. So on original Medicare Part A, you must work at least 10 years, 4 quarters a year, so 40 years, 40 quarters in total, and you will be able to get Medicare Part B for free. You can also qualify under your spouse benefits. Say, for example, if you're a stay-at-home mom and you've never earned 40 points, then you'll be able to get Medicare Part A premium free through your spouse if your spouse has earned enough points. If you do not have enough points, then you have to pay a premium in order to get Part A. If you have below 30 points, then in 2020, you would have to pay $458 a month. If you have points between 31 and 39, then you would have to pay $252 a month. And these premiums do go up every year. So for Part B, which we talked about, covers outpatient services. Part B, actually, the premium varies by income. For majority of people, the monthly premium is $144.60. Now, for seniors who are eligible for Medicaid and Medicare, and they can have those premiums waived because they're paid by Medicaid. So this is just an illustration on what Medicare Part B premium looks like. Say, for example, if you're really wealthy, for a family of 2 and filing jointly, and you would have to pay $491 instead of $144 a month. So on the original Medicare, and if you stay on it and do not change to Medicare Part C, nor you purchase other Medicare supplement plans, these are some of the out-of-pocket costs that you may incur. For Part A, we talked about is inpatient stay. There is a per confinement deductible. It's not an annual deductible, it's a per confinement. Say, for example, if you're admitted in January, then you would have to pay $1,408 each visit. And then if you were admitted in November again, then you have to pay that deductible again. Covers up to 60 days. And if you stay longer than 60 days in a hospital, then you will have to pay, starting 61 days to 90 days, $352 a day. And then beginning 91 to 150 days is $704 a day. These amounts also increase every year. For skilled nursing facilities, so for the first 20 days, it's free. Starting day 21 to 100 is $176 per day. So a lot of people are asking me, you know, does Medicare cover long-term care, skilled nursing facility? The answer is yes and no. The yes part is that if you stay in a skilled nursing facility because of an inpatient stay rather, and for at least 3 days, and it's due to a medical or illness or surgery, then Medicare would cover it. But if the stay has nothing to do with any illness, it's just rather that you're aging, and Medicare doesn't provide any coverage for long-term care. So that's why it is important to consider your long-term care planning early on, okay? So if you want to purchase insurance, then you want to consider that as an option as well. For Medicare Part B, there's an annual deductible, $198, okay? And then after that, you would have to pay 20% co-insurance, no maximum. Say, for example, if you have a CT, which is $1,000, and then you would have to pay $200. There's no maximum on that. And also, there is an excess charge of 15%. What does that mean? That means that if you go to a provider that does not take Medicare assignment, does not take Medicare, then the provider can balance bill you up to 15%. Okay, so make sure that you ask the provider whether or not they accept a Medicare. If they do not, then you would be expected to pay more. Medicare Supplement addresses the out-of-pocket concern we just talked about on Part A and Part B. As we can see, there's a lot of out-of-pocket costs, especially there's no cap. So therefore, you can purchase Medicare Supplement. So literally, it's an out-of-pocket insurance to cover those out-of-pocket expenses. There are standard plans, so basically the only variance is the premium across carriers for those plans, which we're going to show you a little bit later. And then different plans are offered based on different locations. The premiums may vary by carrier based on your zip code, your county rather, your gender, your age, and usually has a monthly premium. And the benefit of having a Medicare supplement is that you can go to any provider, freedom of choice, okay? And only a requirement is that the provider accepts Medicare. And the Medicare supplement is subject to medical underwriting. There are some exceptions on that. For example, in the first initial enrollment period, meaning that when you first turn 65, the 6 months surrounding that. So basically the 3 months, well, actually the 6 months after let's say you turned 65 in November. So the 6 months from that November, you will be able to get Medicare supplement without medical underwriting. So it's guaranteed to issue. And you must have Medicare Part A and Medicare Part B. So these are the standard plans we're talking about. Every carrier in the United States offering Medicare supplement offer the same basically plans. So the only difference is the premium. Plan F has been a very popular plan among seniors, but this plan will be phased out this year for people who are turning 65 this year. So in other words, if you are 70, but you have been on your employer health plan and you're thinking about retiring and you want to enroll in Medicare Part B this year, then you have Plan F. Plan F is not an option for people who are turning 65 this year. Okay, so Plan G is another popular option. The difference between Plan F and Plan G is basically the Medicare Part B deductible, which we discussed is $198. So say for example, if you go to a doctor's office and they charge $200, then you would have to pay, if you select the Plan G, then you would have to pay $198. And the rest would be covered by Medicare supplement. So you will have no out-of-pocket whatsoever. Okay, inpatient stay, outpatient visits, so on and so forth. Now, we're moving on to Part D, the prescription drug plans. When you are on original Medicare A and B, you have to purchase prescription drug plans. Because if you do not, you're going to incur a lifetime penalty, which we'll discuss a little bit later. Medicare Part D available to people with Medicare, and it is the standalone Medicare prescription drug plan, meaning that pairs with your original Medicare A and B. Also pairs with people who purchase Medicare supplement because it doesn't cover prescription drug. As I have discussed, Medicare supplement is just basically a fancy way of saying it's an out-of-pocket insurance for your original Medicare. So it only has A and B, doesn't cover your prescription drugs. You would have to purchase that. Some people may elect Part C, which we'll discuss a little bit more, also called Medicare Advantage plans. If you do that, then you may not want to purchase prescription drug plans because it's included in the Advantage plans. The Part D premiums, just like the supplement, has varies by carriers, of course, and also depending on the location, etc. So, for example, the range can be pretty wide, from $20 a month to $150 a month. The 2020 national base beneficiary premium is around the $32. This base premium is very important for calculating late enrollment penalty. As I've discussed, if you are eligible for Medicare, but you did not sign up for Medicare Part D, I have a couple of clients are actually paying penalty right now. It's a lifetime penalty. The details is that if you are late by 1 month, you'll be penalized 1% of the national base premium, which goes up, changes every year. This year is $32 for the rest of your life. If you're late by 2 months, it's 2%, 24 months, 24%, so on and so forth, okay? So also the Part D premium is based on your income. Say for example, if you're signing up for Medicare in 2020, they're actually looking at your tax return in 2018, okay? And I'm not going to talk too much about it because some of my clients have experienced income change. So 2020 income is drastically different than 2018. If that's the case, then you can actually work with Social Security office to reconcile that. There's a process to go through. So it's based on your income. Let's say if you're in a super wealthy bracket, then you would have to pay $76 more in addition to your regular plan premium. And everybody pretty much has heard of the donut hole. Okay, I'm gonna talk a little bit about if you were to purchase a standalone prescription drug plans, you usually would have 4 phases. The phase 1 is the deductible phase. It's pretty straightforward, is that if you do not meet the deductible, the plan would not pay for it. Now, certain tiers, as we all know, the prescription drug plans have a formulary. And each formulary has different tiers based on the cost and based on the type of medication. You may have generics and brand names and specialties, so on and so forth. So usually for generics, there is no deductible, but you have to really look at your plan specifically. So there is a deductible phase. The maximum deductible for 2020 is $435. And then once you meet that, you go into the second phase, which is initial coverage phase. And the phase means that, say, for example, if you would have to pay $47 for a brand name, that's your copay medication, then you would pay that, okay? And once the total drug costs defined as the cost paid by you and the plan. Let's say you pay $47, the drug itself is a $500. So the total drug cost is $500, even though you only paid $47, because the rest is paid by your plan. When the total drug plan costs, or total drug costs exceed $4,020, you would go to the phase 3, is what the media calls donut hole. Okay, in this phase, it has shrunk drastically, so it has remained as 25%. The brand name and generic is the same. Okay, so in this hole, instead of paying $47, for example, you would pay 25%. Okay, by the time your true out-of-pocket maximum has reached $6,350. So what does this mean? This is confusing. Okay, the true out-of-pocket maximum is different than the total cost, total drug cost we just mentioned in the second phase. In the third phase, the TROOP refers to your deductible, $435, the co-pays and co-insurance you have incurred, the $47, etc. Okay, along with the manufacturer discount. So if you receive a drug that is $1,000, but the manufacturer has given you $700 in discount, you would include that $700 discount as a true out-of-pocket maximum. So the concept here is really help you get through the $6,350 so that you can get into the phase 4, catastrophic coverage. In this phase, then you just pay basically the greater of 5% of the drug cost, or $3.40 for the generic drugs, or $8.50 for the brand name. Okay. So we talked a little bit about late enrollment penalties. So the Part A, for most people who have earned their premium free because they have worked over 10 years, then there's no premium, there's no penalty, of course. But for people who do not have enough points, they would have to pay a premium penalty. Doesn't matter if they have 31 or they only have 10, doesn't matter. So the penalty goes like this for Part A, is that you would have to pay 10% for every 12 months postponement, I'm sorry, and for 24 months. So basically double the number of months that you're late. Okay, so if you are late for 24 months, then you would have to pay the penalty for 48 months. The Part B goes like this: for every 12 months, if you are late, then you would pay 10% lifetime. Okay, if it's 24 months, you pay 20% lifetime, 36 months, 30%. The Part D is that for every month you're late, then you pay 1%, 24 months, 24% penalty for life. So it is very important for us to understand that Medicare is mandatory in a way, but it's assessing the penalties on the back end. It doesn't have any requirement on the front end, but if you are not signing up your Part B or your Part D when you're eligible, unless that you qualify for some exceptions. For example, if you are covered by employer, like we just talked about an example of 70-year-old that is still working and it still has employer health insurance, then you're probably okay. Now let's moving on to Medicare Advantage Part C. Part C is actually run by private insurance companies, okay? And so basically, Medicare has encouraged competition by providing subsidies to insurance companies on a county by county basis so that they can offer original Medicare A and B alternative. So by law, they have to cover all these Medicare Advantage plans would have to pay and cover everything that original A and B covered. So there's no loss of benefits there. In addition, to entice membership, they would have to also to offer additional benefits. So CMS is the watchdog, so they are supervising and regulating the industry for that. There are different types of plans, just like all other health insurance. There's an HMO and there's also a PPO. There are also types, in our region, we don't really have a lot of private fee-for-service, but if you are interested in those, if it's available in your area, and you can definitely look at that and find a knowledgeable, experienced insurance agent to help you understand the pros and cons and differences. There's some special needs program available if you have a chronic illness, like heart problems. There may be some specific plans for you. If you are duly eligible, when we say duly eligible, meaning that not only you have Medicare because you're over 65 or qualified under certain disability that we talked about, and you are also low income, you have Medicaid. If you have both cards, then you have special plans for you. And most of the time, there's no cost for anything except for prescription drugs. Very, very low co-payments on those. So the Medicare Advantage plans is basically on a county by county basis. In our region, the plans in Dallas County may not be available in other counties. So you really have to check. It's based on your residence. And you must enroll in Medicare Part A and Part B. As I have talked about, it is really a competition with the original Medicare A and B. So in order for these insurance companies to have membership, they would offer additional benefits like free vision, hearing, dental, gym membership, over-the-counter benefits, transportation benefits, meal services when you are in hospital. So there are a lot of additional benefits that come with Medicare Advantage plan. The downside of that, though, because it has a network, it has a managed care component, meaning that the insurance company would want to control their cost. There is a network requirement. Doesn't matter whether you choose HMO or your PPO, there is a network component in that. So we're going to talk a little bit about the differences between these networks later in the presentation. So I'm just going to talk about what's new for 2021 Medicare. End-stage renal disease is now covered in 2021 in Medicare Advantage plan. So before 2021, if you are on dialysis, for people who have end-stage renal disease, then you are not eligible for signing up for Medicare Part C. But starting in 2021, that's changing. No longer there's a restriction on that. Because of COVID, telemedicine is becoming more popular and is covered. And acupuncture now is covered in 2021, especially that's very, very important for people who are looking for Oriental and alternative treatments. So, but there are some conditions on that. Your doctor will be able to advise you. It only covers up to 12 acupuncture visits in 90 days for chronic low back pain only, okay? So the enrollment periods, we talked about initial enrollment period, meaning that when you first become eligible, whether you're turning 65 or whether you're eligible for Medicare because of you are on dialysis, for example, or have received disability checks for more than 24 months. So it lasts 7 months, 3 months before your eligible month and 3 months after. And a common eligibility period is for people who are on green cards, okay? So say, for example, you have been in the United States for 5 years, okay? In theory, there's no break in that, okay? So let's say November is the month that you have been a green card holder for 5 years, but you're already 75. So October 2020 is your initial enrollment period, because even though you have been over 65 a long time ago, but you are not really eligible for Medicare until you have been a United States green card holder for 5 years, okay? So let's say November is your eligible month, then you can apply as early as August, September, October. November is your eligible month, then the next 3 months, December, January, and February. If you miss your initial enrollment period, you will be assessed lifetime penalties for Part B and Part D, and then you will double the amount of time that you waited on Part A if you do not have 40 points, okay? All right, general enrollment period is for people who did not sign up timely for Part B, okay? So say, for example, Mr. Johnson just heard of a presentation and he called me and said, hey, guess what? I did not sign up when I first become eligible for Medicare. Can I sign up right now? I said, no. There's only specific time for that, which is between January 1st and March 31st. And the coverage would not be effective until July 1st. So you would have to go every year during that 3-month period. If you miss that window again, you have to go the following year. So that's for people who didn't sign up for Medicare Part B during their initial enrollment period. Every year, that is the period that we're in right now, between October 15th and December 7th, and you can change your plans. This enrollment period is for people who already have Plan A and B. It's not for people who do not have B, okay, or A, because they have to do what? They have to do go to the Social Security office or call them during your general enrollment period to do that. The coverage will not be effective until July 1st. So right now is the annual enrollment period for people who already have A and B who wants to change plans. Say, for example, they're on a Part C plan, but they're not happy with it, or there's a better plan, they want to see their options, it's time for them to do that. Or if they want to go back to Medicare Supplement, then they would have to drop their Part C, and then they would have to sign up for a standalone prescription drug. This is time for them to do that, okay? So if they miss this window, then they would not be able to change it until next year at the same time. We also have year-round special enrollment periods for people who qualify under certain conditions. For example, if they have lost their employer coverage because they're retiring or just whatever, employment reduction, then they will be able to sign up for Medicare in year-round. Or they're moving out of service area. Let's say they're in New York and they're in a New York HMO and they're moving to Texas, and then they can sign up for within 60 days. Okay, it's very important, within 60 days. they can sign up for a Texas HMO in the county that the person resides in, okay? Or the plan terminations. Sometimes your plan may be terminated because the plan is changing, whatever reason, or it's no longer being offered in your area. So if that's the case, then it's not your fault. So the insurance company will let you know that you have a special enrollment reason to do that. And or if you're on Medicare or Medicaid, you have a lot more frequent time periods than people who are just on Medicare. Okay, so just to recap our Medicare coverage, you really have 4 ways to cover your Medicare. You have your original Medicare Part A and Medicare Part B, which is the card that you have. And the downside of that is that you're gonna pay high out-of-pocket expenses. And because you don't have Part D, you're gonna pay Part D prescription drug for not having the plan, late enrollment penalty. The second option is that you just keep your A and B, but you pay for a plan, standalone plan. And the downside on that is you will not have the penalty, but you still have the out-of-pocket expenses we just talked about. The third option is that you can purchase a Medicare supplement, also called Medigap, which is that out-of-pocket insurance we talked about, to supplement your out-of-pocket expenses. So this is the richest benefit because you can go to any provider, right? You don't have any penalties, but you got to pay a lot of money for that. Okay, especially if you have, you know, husband and wife, because you're gonna pay the Medicare supplement premium, and then you also have to pay your prescription drug plan premium as well. But if you can afford that, that's great. And the last option is Medicare Advantage Plan, or Part C. The concept on that is because it requires a network, so there is a network restriction, especially if you choose an HMO. That means that whenever you go to a specialist, you would get your PCP's referral first, okay? So some people find that inconvenient. If you don't like the inconvenience, then you may want to see if you want to pay so that you can have freedom of choice. So basically, if you're willing to put up with that, and you understand there's a network restriction, then it has the most value. And there's usually most of the HMO plans do not have additional premium, so it's kind of free for you. Okay, so it has dental benefits, vision benefits, hearing benefits, over-the-counter benefits, transportation benefits, all of those bundled in one. And most of the plans have reasonable out-of-pocket maximum. Of course, you can compare your options and decide the one that makes most sense for you. So that's why it's important for you to consult a knowledgeable insurance agent to help you with that, because a lot of people don't really know. Because for example, we have all the major carrier plans in Texas, so we know which one's changing, etc. Now let's moving on to the second part of presentation, which is Obamacare. The formal name of Obamacare is the Affordable Care Act, which was effective on 1/1/2014. In order to be compliant with the plan would have to comply with the key provisions. Okay, for example, there's no restrictions on pre-existing conditions. Those have been removed. Children up to age 26 can stay on parents' health plan. And insurance carriers no longer put a lifetime dollar limit on the amount of insurance costs. In other words, if you become really sick, you just pay your out-of-pocket maximum, and the insurance companies will continue to pay that. Doesn't matter how expensive the treatment will be. If it's $1 million, they'll do that. If it's $2 million, they'll do that as well. The preventive care and the wellness visits, as long as they're in-network, will be covered 100%. And the plans must have a minimum value. For example, in the marketplace, it's a bronze plan, meaning that the plan from actuarial perspective would have to pay at least 60% of the cost. And lastly, this has nothing to do with Obamacare, but this is more about the Medicare prescription drug. For the marketplace plans, that's what I meant. But this has more to do with Medicare prescription drugs, is that it has to eliminate that, has shrunk that donut hole, basically. So these are the 10 essential health benefits offered in ACA compliant health plans. So every ACA compliant plans, whether you have Medicare, whether you have individual marketplace, is what we call individual Obamacare, then you would have these services covered. Maternity care, rehab, pediatric services, mental health, preventive wellness, immunization shots, hospitalization, lab, prescription drugs, outpatient services, and emergency services. So we talked about in the marketplace, we're talking about the individual marketplace now, okay? So there are different plans. In Texas, we don't have platinum plans. So we have browns, silver, gold. So they refer to, from an actuarial perspective, the amount of covered costs being covered by your insurance carrier, by your plan. And doesn't matter whether you have Medicare Part C or you have employer health or whether you have individual health, these concepts are the same. So the reason why they're called a managed care network is what? Is to help you with more efficient, more effective medical services with lower cost, right? So cost control is a very important function in all of these. If your plan is an HMO, is health maintenance organization, that means that you have a gatekeeper model. Your primary care doctor, your internal medicine doctor, your family practice doctor is your primary care doctor, and the doctor acts like a gatekeeper. So if you want to see a specialist, you would get your primary care doctor for referral, okay? And if your plan is an EPO, meaning that it doesn't require any referrals, but just like HMO, there's no out-of-network benefits. You have to maintain your benefits inside the network, okay? And then the PPO has both in-network and out-of-network benefits. However, whenever you go out-of-network, there's a risk of being balance billed, right? And then also your benefits are much lower. The point of service is a hybrid of HMO and PPO. Okay, what does that mean? HMO is referral, right? PPO is in-network and out-of-network. So therefore, POS is you require referral, but has out-of-network benefit, okay? The high deductible health plan typically is what we call HSA, health savings accounts, compatible health plan, meaning that these are the plans that you can actually put aside amount of money that is determined by IRS every year. For next year, I believe, it's gonna be $7,100 for a family, 7,200 or 7,100 for a family. So you can, if your plan is HSA eligible, then you will be able to put aside that much money in the HSA account that you set aside. You can do Fidelity, okay? You don't necessarily have to use your employer. You can do individual. And you'll be able to save some taxes. And when you spend your money on health care expenses, eligible health care expenses, then there's no taxes on those, right? You don't, and you can actually invest on some of that. There's a very nice feature I want to mention since we have talked about Medicare, is that if you have accumulated enough HSA dollars by the time you retire, make sure before you start taking Social Security benefits 6 months before, do not put any money into it. You may have some tax issues, okay? So, but the amount of money that you have accumulated, you can actually use that to pay for your Part B premium. That's very nice, instead of being deducted out of your Social Security checks. So you will not lose your HSA dollars. You will be able to use them. So we talked about different provider types. You have your primary care physician, which is your family practice, your general practice, your internal medicine, your geriatrics, your pediatrics, okay? And then specialists. Specialists basically just any providers that we have not mentioned, like your cardiologists, your ENT providers, etc. Hospitals and ancillaries. These are your radiology, your imaging centers, your labs, your ambulatory surgical centers, etc. So when you go to your outpatient visit, you basically have 3 actions. If you call your doctor, that's office a visit. Doctor offices, as you know, you have to make an appointment, okay? And is usually for when you want to do your wellness checkup, or if you have some diagnostic needs, you're not feeling well. Urgent care is for folks who want to see a medical professional right away, but it's not life-threatening, okay? Urgent care is a lot more cost-effective, it's cheaper than you go into emergency room, okay? So emergency room is a visit that is so severe, it's life-threatening, that you have to seek medical care right away, okay? But ER visits are expensive. So depending on the type of visits, you want to plan accordingly. These are some basic terminology in health insurance overall. Deductible. Deductible is the amount that you're responsible before your plan starts to pay. The copay and co-insurance is what I call, your responsibility. So every plan has 3 phases, okay? The first phase is your deductible phase. If you have not met your deductible, then your insurance company will not pay anything. The second phase is the co-insurance phase. During this phase, you're responsible for some, and your insurance company is responsible for a bigger portion. Say, for example, you pay 30%, they're responsible for 70%, okay? So the copay and the co-insurance are all the piece that you're responsible for, you're contributing, but the copay is a fixed amount, and the co-insurance is a percentage. That's the difference, okay? But the concept is the same. And then the third phase is the out-of-pocket maximum phase. This phase means that once you reach this maximum, you no longer pay beyond this maximum. Your insurance company will pay 100%, okay? The last concept is balance billing. Balance billing is whenever you go to an out-of-network provider. Say, for example, you're in HMO and you go to an out-of-network provider. Unless it's a true emergency, because most insurance company would actually pay that emergency care, even though it's in an out-of-network provider, they would pay that as if it's in network, okay? So unless it's emergency, if you just choose to go to an out-of-network provider, then you will have the risk of being balance billed, because that provider does not have an insurance contract with your insurance company. They can bill you whatever. Sky's the limit. They can bill you $10,000, $20,000. That's the balance billing. Of course, you can complain. You can go to TDI, all of that, but that's the risk. Okay. So we always advise our clients, always understand your risk and make sure you go to your in-network provider for your maximum benefits. Okay. So the ACA individual health insurance compliant health plans offer subsidies, okay? And the subsidies is based on federal poverty level between 100 and 400. The subsidies are used to reduce your monthly premiums, and you would have to claim them as tax credits when you file your taxes in the following year. The eligibility is that right now is the Obama individual health insurance enrollment season. It runs every year between November 1st and December 15th. You must live in the United States. You must be a resident, right? And you must be a legal resident. You can be other visa holders, like say, for example, H-1B, or you have employee EAD card, you have L1 visa, etc. Those are fine, okay? Or even sometimes you have F1, F2, J1, J2, those are fine. you can be any of those. And of course, green card and citizens are eligible. And during this time, you can sign up for the plan effective 1/1/2021. And you can also review whether or not your income would qualify you for getting subsidies. So these are the federal poverty levels between 100 and 400. Say, for example, for a family of 4, if your income is below 26,200, then it's too low to qualify for subsidy. And if your income is over $4,800, then you're not qualified either. So if your income is in between, then you are qualified. And of course, the number is closer on the lower end, you get more subsidies. But if your income is approaching the upper limit, then you get lesser subsidies. And you would, irregardless, you would have to file your reconciliation, because say, for example, we're signing up for 2021 plan, we're actually estimating, because we don't know, I don't know how much money I'll be making in 2021, but you will be estimating your income in 2021. And let's say in 2022, you file your 2021 tax return and the income is different than what you were estimating. There has to be a reconciliation piece. Your CPA can help you. Most of the tax filing software has that function as well. So make sure that you do that. Otherwise, you may lose your subsidy if you do not do reconciliation. So just give you an example. Let's say a family of 2, okay? 64, 62. And if their income is $20,000, they may actually be eligible for a month, $1,849 worth of subsidy. They can get Brown's plan. Some of the Brown's plan may be free for them. Or if they want to choose more expensive gold plan, then they see the range there, $360 to $700. If their income is $50,000, they can still get subsidy, but there is a difference. So the difference isn't that great. So there's some difference, is only $400. So they can still get some Brown's plans for free, but if they want to get gold plans, they may pay up to $1,000. So there are different carriers offering different plans. Make sure you understand the differences, the network differences. Different carriers have different network panels, and they have a different out-of-pocket maximums as well. And they may have different co-insurance components. And so make sure when you compare your health plan, you understand the key concepts we just talked about, whether they're deductibles, whether they're out-of-pocket maximum, whether they have an HMO or EPO, so that you know if you need to see a specialist, you need to get a referral or not, okay? So now for folks who are looking for non-Obamacare, for example, you're very healthy and you are making a lot of money or too little money, that you are not eligible for a subsidy, and you want to find a cheaper option, there are non-ACA compliant health plans out there. The reason why they're called non-ACA compliant is because they're not required to comply with the provisions we talked about. They usually have restrictions on pre-existing conditions. There's no coverage for pregnancy or delivery. There's usually a benefit maximum on what the plan would pay. Say, for example, $1 million or $2 million. There's usually no preventive care coverage, meaning that you would have to pay out of pocket yourself. There's no 100% coverage there. Most of the plans have very limited RX benefits, meaning that it's not a $2 million, it's just a couple $1,000, okay? So although there may be some more expensive plans may offer you a little bit better on the prescription drug coverage, but you really have to understand the details, okay? So for your non-ACA compliant health plans, most of the plans is less than 1 year. Although, because the Trump administration has been promoting the short-term medical, so some of the plans can be renewed up to 3 years, okay? So make sure you find an agent who can explain the restrictions and differences so that you can make a informed decision. There are some other types of indemnity plans. I really wanted you to understand those because the reimbursement is based on the actual medical expenses maximum. Okay, so you have to understand your benefit maximum. If you, let's say, go to a hospital, you're gonna receive many bills, not just one bill. You have your hospital bill, you may have your surgeon's bill, anesthesia bill, your radiology bill, you may have your technical component of your radiology bill, you may have your lab bill, you may have your whatever, doctor visit bills. You have a lot of bills, okay? So make sure you understand when you choose reimbursement plans, you have a good understanding of how medical billing works. So then you'll be able to decide, does this plan make sense for me? Should I have an expensive inpatient stay? How much money would I be expected to be reimbursed? Are you okay with it? Okay. So usually there's a restriction on pre-existing conditions as well, and there's no coverage for pregnancy or delivery. Now, there's no network requirement because of reimbursement plan. You can literally just go to any provider and you would have to negotiate, right? So the plan doesn't pay a provider because it's not a traditional network requirement. There's no contract between a provider and the indemnity plan. You wouldn't negotiate because it pays you. So, and then that's why I said knowledge of basic understanding of US medical billing is important. It will help you because if you have no clue, then you would not know how much you're going to be reimbursed by the time that you really are admitted to a hospital, okay? And usually these plans have very limited preventive wellness coverage, okay? So my advice, just to sum up on this, is that if you're really healthy, yeah, this may be an option. And you are not planning on having babies, this may be an option for you. But if you have pre-existing conditions, if you are really just not great in negotiation, healthcare costs, you know, English is just one function, you know. A lot of people, a lot of my American clients, and you know, English is not the concern. It's not the language barrier. It's the industry barrier, knowledge barrier. They don't know what to negotiate. Okay, and you want to make sure that you are comfortable with that risk. Okay. And lastly, just to sum up, make sure that you understand your plan. So it doesn't matter if you have Medicare Part C, or if you have individual Obamacare, you always will review your summary of benefits, okay? Understand your deductible, understand your network restriction, research your doctors first, make sure you're comfortable with the network, understand how to search in-network providers because you're gonna have some needs that you didn't anticipate. You wanna know how to find out which doctor is participating in your plan. Make sure you understand your co-insurance and copay and your out-of-pocket maximum. And make sure you understand the rules of your plan. Say, for example, if your plan requires pre-authorization, then you want to make sure what kind of services, like sleep studies, for example, if you want to get, you know, sleep machines, usually, you know, that's no-brainer. You got to get pre-authorization. If you are going to get an expensive CT, MRI, usually those have pre-authorization. If you're going to get an outpatient surgery, that usually has pre-authorization. Make sure you follow up with your doctor and your insurance company to make sure, because I personally, this year experienced something that was not fun, was due to a confusion, right? So it's still your responsibility to make sure. Fortunately, I follow up. So otherwise it's gonna be a mess, because if you did not follow up and for some reason your doctor makes a mistake and didn't do that properly, and insurance company may deny the claim, okay? So make sure you understand the terms and conditions of your insurance contract, and inform them if you anticipate any of those services that require pre-authorization, and make sure you understand referral requirements. Okay. All right. I do see a couple of questions. And so, yeah, what's the best way to find out if a doctor is in network? Call the insurance company or the doctor's office. This is a great question. The best way to find out is both. So first of all, you go to the insurance company's directory and to see which provider is participating. However, many of the time, the directory is out of date, okay? So the insurance companies actually put a disclaimer saying that, hey, you still have to verify. So call the doctor office afterwards. So I would advise you do both. All right, so like I said, if you guys have any questions, we're really on time, we're wrapping up. And just give me a call or email me if you have questions, or if you like, you know, want more specific things you want to talk about regarding your Medicare needs or health insurance needs in general. I'm available. Okay.
Yes, thank you so much, Ray, for a very, very informative presentation. I think, you know, I've been in the US for 20 years and I have went through, you know, regular corporation. Now I'm a 1099, but luckily my husband this year have, you know, the company coverage. So when we are on our individual plans, that was very expensive and very confusing. And I think, you know, your presentation helped answer some of the questions, but it's still, you know, very, to me, even I don't have a language barrier, like you said, I have technical challenge regarding, you know, especially when, you know, when I'm, throughout my pregnancy, you know, there's the doctor in network or not, the ultrasound, whether it's in network or not, and all this, you know, services that's involved, whether they're in network or not, right? My primary care is in network, but the professionals he's associated with, right? When I went to an unplanned C-section, the the people who help with the C-section was not in network, so they all cost lots of you know, additional fees we have to pay. So
Yeah.
I think from my own experience, it's critical that we know, you know, we can do as much as homework as possible, but, you know, relying on professional like you to guide us in choosing the best plan that for us. And it, you know, it can change year to year based on your needs, right?
Yes, absolutely.
Yeah.
Great. So thank you for inviting me.
Yeah.
And we have recorded this video.
Yes.
And Cecilia is going to post this online for folks. Due to scheduling reasons, we actually didn't announce this soon enough, right? So for people who missed the opportunity to see this, and they can replay it. Okay, I see a question coming. Let me just see.
Yeah, so we are going to post on our YouTube channel and share the link with you as well, Ray, so you can share with your clients. And you know, the first part was mainly focused on Medicare, right? And then the towards the end, we are more focused on individual plans, Obamacare, and, you know, things like that nature.
Sure.
Yeah.
Yeah, as someone asked, for someone generally healthy, how do you decide if Medicare Advantage plan is more suitable or Medicare Supplements? This is more of a short range and long range planning on your part, okay? So if you want to save money and you have more bang for the buck, so to speak, and you're comfortable with your network restriction, then most people would choose Medicare Advantage plan because it's no brainer, right? Now, the downside of it is that one day, if you decide to want to see a provider, you got some special type of illness that is so rare, only a handful provider would treat it. And for some reason, those providers are not available in your plan, then you may want to go back to your supplements. However, because of your condition, health condition, you're not eligible for Medicare supplement. because remember we talked about it's subject to medical underwriting. So yes, so that is a decision that you have to make. None of us has a crystal ball in front of us. So all I can say is Medicare Advantage plans are improving. So it's the likelihood of that happening that has none is pretty slim, because if so, then you can actually make appeal with the insurance company and see if they would be able to make an exception for you, right? Because there are supervised by the government. But still, like I said, if you don't want to have the inconvenience of making sure that the provider is in your network, then definitely Medicare Supplement is the way to go. If you have the financial resources to afford Medicare Supplement, then that's the way to go as well.
I know our time is up, Ray, but I do have one question, because we are kind of impacted by COVID right now. So from a individual standpoint, if there's no coverage from the company and you have to buy your individual plan, you're a family of 4 with children under 10 and no pre-existing condition for COVID, what's the coverage on, if somebody in the family get, infected with COVID, and what is, can you talk a little bit about that? I think lots of people are probably wondering about that.
Yeah, exactly. So for marketplace-based Obamacare individual health plans, there's coverage for sure. The diagnostics typically is free. Okay, the treatment is subject to out-of-pocket maximum. So there's a misunderstanding there. The treatment is free. The treatment is not free. Okay, the treatment will be subject to whatever your out-of-pocket maximum would be. Okay. Now, if you are thinking about getting a non-ACA compliant plan, those plans actually are covering the same. Okay, as long as the plan that you're selecting is a reputable plan. Okay, it's not one of those travel plans, because there's some travel plans that actually have restrictions. This is primarily for the immigrants. Okay, so some of them purchase these cheap travel plans, and some of the travel plans actually stopped covering COVID as of March. Okay, so make sure you understand the specifics. But the plans we're offering are all the reputable ones, so we don't have those issues.
Great, thank you so much, and
no problem.
Have a nice weekend, and
happy
Thanksgiving for
everybody. Happy Thanksgiving. Thanks.
All right, have a good one. Bye.
You too. Bye-bye.